My boss was very excited that I used the word naughty in the title. So I'm going to tell you about how Nodal, an embryonic protein, helps breast cancer cells escape certain death by gamma delta T cells. So, I think it's coming. Is it coming? Tumors contain many different types of cells. There are the good cells, the white blood cells that come in and try to kill the tumor cells, and there are the bad cells that support tumor growth. T cells are a type of white blood cell. They are the good cells that kill the cancer cells. Here they're shown in blue, and you can see them punching holes into a nasty red tumor cell. Now, there are different flavors of killer T cells. My favorite are the gamma delta T cells. They're rare but potent T cells in the blood. And shown here on the right are some microscopic images that I have taken of T cells from humans. Gamma delta T cells can kill many different types of cancer cells, as shown here on the slide. I myself, in the lab, have shown that they kill leukemia cells, they kill prostate cancer cells, and they kill brain cancer cells. And today I'm going to talk about breast cancer, hence the pink. And higher gamma delta T cells in the blood typically correlate with better patient outcomes. So the more gamma delta T cells the patient has in the blood, the better they will do. And because of this, we're developing gamma delta T cell therapies, whereby we take gamma delta T cells from the blood of patients, expand them in the lab, and inject them back in. Or they can also be expanded in the body by use of certain drugs. However, there is one group that has found that higher levels of gamma delta T cells in breast tumors may mean a poorer outcome for patients. So we want to know what's going on. I think this is the chicken or egg scenario. Are the gamma delta T cells there in higher numbers to try and fight the cancer? Or are the higher numbers of gamma delta T cells somehow helping the tumors to continue to grow? So this is the question we're asking. And so in the lab, I can take gamma delta T cells from a healthy donor blood, grow them up in large quantities, and then subject them to lots of different tests to see what they're doing. And I can show that they can kill breast cancer cells, for example. Gamma delta T cells recognize their tumor targets via proteins on the cell surface. And depending on what proteins contact one another on the two cell types, we get killing or multiplication of the gamma delta T cells, or they can call in other immune cells for help. But cancer cells can also hide from gamma delta T cells so that they can't be seen and can't be killed. And we wondered whether Nodal might be helping in this process. So you're asking, what is Nodal? Nodal is an embryonic protein. That means it should only be expressed in the embryo. And in the embryo, it directs the body axis. So it basically decides what becomes your head and what becomes your tail. And it's naughty because it's turned back on in many different kinds of cancers, and it shouldn't be there. Shown here are a bunch of different cancers where Nodal has been found, and Lynn's lab looks specifically at Nodal in breast and ovarian cancer. In breast cancer, more Nodal means worse disease. So Nodal is shown here in brown, and you can see normal breast tissue on the left, progressing cancer all the way to metastatic breast cancer on the right. So more Nodal is a bad thing. There are areas in tumors where there's low oxygen, and this causes cancer cells to make even more Nodal that makes the cancers even more aggressive. But in the lab, we can knock that Nodal down, and we can make the tumor cells less aggressive. So I can use these tools to see whether gamma delta T cells are better able to kill cells that have Nodal or don't have Nodal. And I've found that gamma delta T cells can much better kill the cells that don't have Nodal compared to those that do. And finally, I wanted to know whether gamma delta T cell migration into tumors is affected by Nodal. So using Hahn's CAM assay, we can see here that gamma delta T cells are on the outside of tumors that contain Nodal, but are able to get into the Nodal knockdown tumors. So in summary, gamma delta T cells kill breast cancer cells. Nodal somehow inhibits this process. Nodal may stop gamma delta T cells from getting into tumors in higher numbers. and that thereby helps the tumor cells to escape. And finally, I'd like to thank all of these people on this slide and the Ignite Cancer organizers for allowing me to come and talk to you today, my funding from the TBCRU and the Cancer Research Society, and finally you for your attention. Thank you.